What is health insurance? Health insurance is a contract between a company and a consumer. The company agrees to pay all or some of the insured person's health care costs in return for payment of a monthly premium. The contract is usually a 1 year agreement during which the insurer will be responsible for paying specific expenses related to illness, injury, pregnancy, or preventative care. Health insurance agreements in the US generally come with exceptions to coverage, including a deductible that requires the consumer to pay certain health care costs out of pocket up to a maximum amount before the company coverage begins. One or more co-payments that require the consumer to pay a set share of the cost for specific services or procedures. How health insurance works. In the United States, health insurance is tricky to navigate. It is a business with a number of regional and national competitors whose coverage, pricing, and availability vary from state to state and even by country. About half of the population has health insurance coverage as an employment benefit, with premiums partially covered by the employer. The cost to the employer is tax deductible to the payer, and the benefits to the employee are tax free, with certain exceptions for S corporation employees. Self-employed people, freelancers, and gig workers can buy insurance directly on their own. The Affordable Care Act of 2010, commonly called Obamacare, mandated the creation of a national database called healthcare.government, which allows individuals to search for standard plans for private insurers that are available where they live. The cost of the coverage are subsidized for taxpayers whose incomes are between 100% and 400% of the federal poverty threshold. Some, but not all, states created their versions of healthcare.government that are tailored to their residents. People over the age of 65 and those with disabilities and stage renal disease or ALS qualify to receive federally subsidized care through Medicare, while families whose incomes are near the poverty level are eligible for subsidized Medicaid coverage. Types of health insurance. Health insurance can be tricky to navigate in the US. So-called managed care insurance plans require policyholders to get their care from a network of designated healthcare providers. If patients seek care outside the network, they must pay a higher percentage of the cost. The insurer may even refuse payment outright for services obtained over the network out of network. Many managed care plans, for example Health Maintenance Organization HMOS and Point of Service Plans POS, require patients to choose a primary care physician who oversees the patient's care, makes recommendations about treatment, and provides referrals for medical specialists. Preferred providers organization PPOS by contrast don't require referrals but do set low